Hi, welcome to the Maintain Me resource channel. I'm Morgan Jenkins and I'm the director at Maintain Me.
Hi, I'm Chelsea, RN and owner of Maintain Me. Today we're going to come to you. We're going to give you a quick industry update through COVID. And then also we're really excited to talk to you about how our new program was born. So with that being said, Morgan, let's take a second to update our community and our friends and family about kind of what was going on in the aging population and a little bit about transition services, and talk about kind of the reality and kind of the shift, so to say, as to where our clients are going now, and what they're thinking, where they're at. So can you tell us a little bit about April and what that looked like when COVID hit and how that affected us in transition?
Yeah, I'd love to. So for those of you that aren't familiar, transition means when somebody moves from their home into a community, whether that be an independent living, assisted living, or memory care. While Maintain Me does offer case management, transition had been the bulk of our service. Definitely. And what we saw in, I can almost say to the date in March and April was the industry in that way shut down because it had to. And so we had no new clients during that time that were transitioning. And of course, we each carried, a fairly decent book of pending clients and clients that we continue to work with. But there was so much fear surrounded, that went into the idea of moving into a community because of what you're seeing in the media and the deaths and everything that was going on, that people were just, I would say, frozen in fear.
Yeah, I think you're right. I think that consumer faith, and what we had to offer was just, it was down, right? They didn't really know what to expect. Nobody did, right? Like nobody really knew. We didn't know enough. We didn't have enough education. And then we started seeing a slight shift, right? So April was radio silent, and then say May, right? We start seeing this increase in safety over choice, right? Like, so this is when we start seeing our clients who, safety was such an issue at that point that choice now was put on the back burner, and like this was real for them, right? Like they had to go through this whether they liked it or not because of safety or isolation or whatever. You had one of those earlier transitions. Can you talk a little bit about, absolutely this was possible, right? Like our community partners were doing a fantastic job trying to figure out, how do we protect the seniors that we currently have? How do we keep going, right? Like how do we do this in a way that we're honoring the people who live there, serving the people who still need help? Like they were on top of it, right? And getting updates weekly, all of that. And so there were times where we had to help those either memory care or safety transitions, and you had one of the earliest ones in that. So tell us a little bit about the barriers, because it wasn't impossible, right? Like after they started getting admissions again, because they did shut down for a second, but once they started accepting admissions again, it wasn't impossible, but there was a ton of barriers, right? So like just a ton of hoops, right, that these seniors were having to jump through, or the families were having to jump through, that prevented people from maybe even trying. Right. So what were some of those things with that first transition with that client?
Yeah. So safety, you mentioned, was a big concern, and it wasn't only safety for the residents that already lived in the community. It was safety for their staff, safety for the staff's family members when they went home. It was safety for the people that worked there. Everybody was working towards that same goal with very unclear direction. Just because of the unknown. I mean, it's a pandemic. We've never done this before in this generation. So my first transition during COVID was a woman I'd been working with for, I think, 2 years. And she had limited family in town. We had already done several tours. She was independent living at the time we were doing our tours. And then flash forward about a year and a half from the last time we toured, it was June 2019. Her family member reached out to me and said she is declining. She has a very serious UTI. She has been enrolled in hospice. And I said, wow, oh my gosh, that's a huge decline. What's going on? And she had been isolated. Her little dog had died. She just had mounting issues that were preventing her from living her best life. She was alone. She was suffering from it. So when we looked at it, she said, I already toured that place, that community. That's the one I want. I said, beautiful. That's easier. We don't have to tour. We don't have to do anything. We have to find the right apartment. And then the next step was, that was all fairly easy. It was coordinating with this brand new 24/7 care that she had brought in. It was coordinating with hospice and coordinating all of this. It was coordinating 2 COVID tests. When hospice was her primary care now, giving COVID tests. So
right.
they were saying, you know, well, maybe you can call Dispatch Health. And Dispatch Health said, that's not what we do. We're not doing that. So from the very beginning, she had to have 2 negative COVID tests before they would even let her move in. We got to 3 days before she was about to move in, and an employee came up COVID positive at the community. They caught it right away. There was no community transition. That person had no symptoms, and they ended up having to shut down again. So that pushed her admission out 2 more weeks and to for COVID 2 more times.
Right.
So that was only obstacle 1. She happened to get a first floor apartment, which was great. People were moving possessions into apartments from the window.
Right.
So they could have one person help. They could have one specific moving company. You had to coordinate with that specific moving company. Then getting the items in. Okay, once the items were in, there wasn't a family member allowed to help her unpack. So did the community step in and help her out a great deal? Yes. But this was a safety issue for her. She was isolated. She was declining. And this ultimately was going to be what, you know, for lack of a better word, got her back up on her feet and made sure she had what she needed.
Yeah, no, that's great. I mean, you touched on the big ones, right? The isolation in the home with lack of support or family being distant. You talked about, you know, I think it's really important to think about what would she have done had she not had you through those 2 years, right? Someone just to talk to. You also talked about her going on hospice. So when you're billing somebody's primary insurance, which is what hospice is supported under, you know, just coming from knowing the lab side, you know, you can't bill secondary insurance for these labs too. So then you're waiting on either free or state labs results. And so it just adds this whole extra layer of already having to make a serious change in an aging loved one's life, even more challenging with all these things that have to be done on top of what's typically has to be done, which is not an easy process in itself. And then all of this fear, and it's just a lot, right? So we start seeing things jump up July, August, September. We start seeing our existing clients start kind of moving a little bit, right? We're starting to learn more about the pandemic. We're starting to get very clear instructions from the state on what our job is as well, which the state has never really touched on, but even kind of how we should be handling business as far as, you know, virtual tours and all these things, which I'm telling you, I've never we are not as regulated as most, especially assisted livings and community settings. And so to see the state even give us clear guidance on how to serve our clients in that was pretty awesome, right? So we start getting all this clear direction from the state about, you know, how are we going to do this? How are we going to keep moving? You know, obviously we can't be shut down forever. So let's figure out how to learn and get clear direction. So then we start seeing July, August, September, our clients that have already been existing and have been almost like waiting, right? Start to move. And so through all those times though, I think what's important, you know, that's kind of like a big industry update, right? Like that's April through September. I think really what we want to talk to you guys about today is through this, and I can speak, and Morgan can speak to this probably even more so than myself. Yes, transition was slow, but phone calls on what to do, how to get help, you know, what exists for me, how does my insurance work? Like there were so many phone calls coming in that we could absolutely help with, right? Like our knowledge and our experience and every single one of us having different experience, we found out like we were spending more time on the phone helping these people for free, of course, saying these are the things that are available to you. And we need to figure out how to help these people, right? And talking to them on the phone wasn't quite enough, right? Like we could give them resources. This is exactly what I ran into in the hospital, right? You can give people resources day in and day out, but there are certain people who need more help depending on their support, depending on even their ability, right? Like, can I hear on the phone to make those phone calls? Can I do I have a phone? Do I have a computer? Like, so there's just all these extra things. And so, yes, we were helping people on the phone, but not to the place that we wanted to be helping them. Right. And so Morgan comes to me because she's brilliant, right? She's like, we need to figure out a way to help these people. Like, yes, we're helping them. We're on the phone, but they're still calling me, or, things aren't getting done, or I'm getting the same phone calls about the same stuff. And like, there's something there, right? We need to help these people. So through COVID, this is why my background, that's why my background, I'm grateful because it's really easy to focus on the negativity through COVID. I think all of us have empathy right now through what everyone's going through. But for Maintain Me, especially, like, we had a program born through COVID, and we're really proud and we're really excited and we want to roll it out. We want to tell you guys all about it. And that's where our consulting program came from. So Morgan, tell me a little bit about, like, when you sat, like, just give them a little update when you're like, Chelsea, Kate, like this, like, we need to figure out what to do. We need to figure out how to help these people in the interim or come up with a new norm, right? So talk a little bit about that, and then we'll jump into telling them how we're going to roll out and educate them about what's next.
Yeah, thanks, Chelsea, and thanks for the kind words. What I was seeing is a need to build this into Maintain Me's business model. So we needed to expand our already expansive services to truly meet our clients where they were at. And where they were at, the phone calls I was getting is people were afraid. People didn't want to move in someplace and not be able to see their loved ones, or have the freedom to eat their meals in a dining room with the community that they are seeking. So it was, how do I maintain? How do I keep myself safe? How do I help my loved one in another state with all this day to day? How do I help them maintain who they are and not move into a community? So I said, we got to do this. We got to figure this out. So shout out to Tish and Tish Gantz and her user experience. We worked with her over the summer months to really dial into what our consumers were experiencing. We wanted to know what they were experiencing firsthand so that we can help them with very specific direction and help them in a way that was actually helpful, not just giving them resources. So the calls that I was getting, I think that's what you wanted me to touch on, the calls that I was getting.
Yeah, those are awesome. You're like, these are the people we have to serve. I'm like, that's gold, right? Like that's exactly what we're seeing.
Yeah, two big examples. A gal that lived at home had an amazing support network of neighbors around her that were also isolating and could bring her meals and check on her and make sure she was doing okay, but she would frequently fall. And the fire department came one last time and said, we're not coming back. If you fall again, we're gonna send an ambulance and we're gonna have them take you to the hospital. And to me, that was preventable. And so what I was seeing was, okay, how do we build up the support network? It's there. How do we engage them further and help her get the resources so she can stay at home? That was her wish. And we did it. We got home care involved. They did Zoom interviews. They also did in-person interviews. That company, Touching Hearts at Home, was amazing. They stepped right in. Another call I received, I was thinking of that one. Another family that I was working with didn't have access to meals. And so they were declining simply because of meals.
Nutrition. Mm-hmm.
Which is a huge thing. It's hard to go to the grocery store. It's hard to plan for meals for you and your husband day in and day out, especially if you already have a chronic illness. In this case, her feet hurt. She had neuropathy in her feet. So simply walking into the kitchen and making a meal, which seems so simple, when she didn't need help with anything else. She didn't need help with medications. She didn't need showering assistance. and or getting dressed or anything like that. She was completely independent, but she was exhausted by meals. Okay, great. Let me, the first part of that would be assessing. So that's me getting to know this client and her needs and her husband's needs from an assessment. Then the next step would be, okay, what resources exist? And then how do we engage them? And how do we assure safety to our clients with this resource we're connecting? And this is all what we ultimately do in our consulting program.
Yeah, so that's perfectly said. And I think just to touch on that nutrition a little bit, they might see, and families might see that fix the nutrition, like, oh, okay, cool, we'll get meals, right? And or it's something so little, when we all know in the care industry, especially being a nurse, that if nutrition isn't good, now we've got, what if they get a wound? Now wound healing isn't good. Or what if they are too weak or their blood sugars are not regulated, and so they fall because their nutrition, so they missed lunch, their blood sugar dropped, they fell, they now have a wound, the wound healing's decreased. So like, there's just so much into such a simple thing that we could have done to fix or to help provide a resource for, that could have prevented so many things in the long run, right? And trying to be proactive and trying to educate. And I think that's the biggest thing with our consulting is identifying, educating, and then also being their right hand, being their person if they don't have that person to be there, right? And we like that part, right? That's where we thrive, is being that person. And so awesome. Thanks, Morgan. So this is what we're doing, guys. Like, first of all, we have to talk about our backgrounds. I'm in a closet right now because I have children, right? And I am talking to all you moms and family members out here who have children and who lock themselves in the closet to have a phone call. So I have this really beautiful background that we just learned. Morgan and I are getting tech savvy. And, it's just the reality of all of us being home. We have something to share. We want to share it with you. We're starting this new channel. We're going to be authentic. We're going to be just us. We're going to mess up. Like, we were like, we're just going to go on. We're just going to try it. So we're excited. We're really excited. We're going to start bringing topics to you guys. One of them today was, we just really want to roll out this program. So in November, we're going to focus really hard on showing you the difference from our consulting program from transition. So just so you know, if you're not very familiar with Maintain Me, and Jessie, our amazing office manager, she is going to be putting together a lot of things that are coming out on Monday to kind of roll out this program and tell the community what we're doing. And so we're going to do some videos around that. But on top of that, this channel is going to be based off information. So if there's information that you guys want, maybe you're a caregiver, maybe you're in the care industry, maybe you want to be partners with people, like whatever it is, we want to educate you on what we know. And if we don't know, we are never going to fear away from learning something. So if we don't know, we're going to tell you we don't know, and we're going to find out, we're going to learn, and we're going to grow, and then we're going to come and try to be that for you. So, but we're gonna come every single week or every other week. Morgan, we decided we're gonna try to start videoing as much as we can. So any support that you guys have or any suggestions, we would absolutely love. But Morgan, I love that you're on the television right now.
Yeah, I thought I'd be on TV. This is my 15 minutes of thing.
We thought we were going to come on here and record for 3 minutes, and we have a lot to share. So it's probably going to be longer than that. But anyways, guys, please follow. We are going to be adding this video. If you're watching it through our email, it's because we're going to start adding these on here, trying to be a little bit more personal. We want you to know we're here. I'm an extrovert, so being locked in my house is I'm like, this isn't going to work for me. So we're going to get on video. We're going to make it happen. And yeah, anything else, Morgan, you wanted to add? Jessie's going to be, I just wanted to touch really quick on the 3 programs. So what Maintain Me does is we do transition majority, right? We help people transition to independent, assisted, and memory care. We also have a case management program. That case management program is designed more so for somebody discharging from an acute care setting or a short period of time to help them stay safe, get them back up to their baseline. We work with other people who do long-term case management, but our case management program has been very much geared towards decreasing hospitalization, adding extra support in times of need, especially when there's been a change of condition. And so now our consulting is, hey, because our goal has always been, we want to meet you where you are in the aging process. And we want to meet you where you are, regardless of what that looks like. And so in order to do that, this consulting program had to exist. And I'm so grateful that the pandemic kicked us into gear to make that happen. So our consulting program will have 3 programs. We're going to spell it all out over the next couple of weeks. But it is going to really be for those people who are starting to identify they need care, or they are ready to take action on care, or there has been a big, quick change of condition where we're in an emergency situation and we need care now and we need help because we don't have the time to do the research. And we as a team come with a big, like just wide range of knowledge and background. And so we can fill that need very quickly. So we'll spell that all out over the next couple of weeks, of course, with a fun little holiday thing in the middle, because we're not going to try to educate on too much hard stuff during the holidays. So we'll bring some fun holiday knowledge in, and then kind of wrap it up for December. So anything that you want to talk about, Morgan, before we sign off?
Yeah, I just wanted to touch on something real quick that I think is it can be confusing in our industry. So what we refer to as transition, other folks refer to as placement. We prefer the language around transition because any support we provide is truly a transition in your life. And the transition program specifically, once a family identifies a community and moves in, that community pays our fees. It's not a free service. It's free to the individuals. It's free to our clients. It's not free altogether. Someone is paying our fees. That's that community where you choose. Now, with both our case management and consulting program, those are going to be private pay. So our clients see the value in our resources by paying us out of their income to help. There can be reimbursement from long-term care insurance, and we can talk about that with our clients individually. I think there's opportunity to reach out to your insurance and say, I'm getting this extra help. Chelsea's a nurse. Is there any reimbursement opportunity? Because this is saving my insurance money by keeping me out of the hospital. So if you think about, let's just throw out $500 or if you spent privately $500 to work with Maintain Me. If you think about one hospitalization, one admission, or even visit to an emergency room, you've nearly tripled that. So when we think about the investment up front, while it may seem like a high dollar amount, it really is nothing compared to what it would cost if you have a fall, or if you have to go, God forbid, to skilled nursing or stay in a nursing home. Not that they're bad, but that's a drastic change from being at home and independent to having to go live in a skilled facility. So when we look at apples to apples cost, this small investment up front is a wise one because it will save you money in the long run.
Yeah, and I think it's fair to say that, I always joke around that most of my friends are over the age of 80, and I kind of like it that way, right? But I think it's fair to say that by connecting them to someone like us gives them a lifelong friend or a lifelong resource when things are changing, right? And instead of calling the emergency department, they now have their person that they not only trust, right? Because we're going out there. I mean, there was obviously some restrictions on that in the beginning, but we are physically going out there in some of these cases and meeting these people. Do we have to go out there to do consulting? No, but we're building a rapport regardless, right? We are spending the time that they need to find someone that they trust, right? Up until this point, if they have nobody else, their only trust is the emergency room, right? It's like a one-stop shop. Like, I'm going to go to the emergency room because I don't have anyone else that I trust will give me the information that I need to be safe, and I'm scared, right? So I think it's fair to say that not only are they paying for the services at hand, but they're paying for a connection of getting themselves connected. And it's just like when we have like our veterans when they're service connected, or we have any of the other populations like our autistic group. We connect all of these people and we get them connected into resources so that down the line, if something happens or something needs something, that they have somebody that they can go to. And so we want to be that person. We don't want anybody having to go to the emergency room because they didn't know who to call, right? Like that's like, you call us. Right? Like even if we tell you to go to the emergency room, at least now we can call over there and kind of tell, like, so we could just be the advocate in a way of like, we've already met them. We know what their baseline is, so that if baselines ever change, we can step in and say, no, this isn't normal. Like, can you help them? This is, this is what we were doing before, and this is what was happening. So I think that's important to say that, your cost goes toward getting these people connected to the right people throughout wherever they are. So, okay, awesome. Well, I think that's about it. We could go on and on, especially Morgan and I. So, and we will too, if we don't cut it off. So anyways, we love you all. We hope this is helpful. We're excited to share our new program. Give us your feedback. Yeah.
Feedback.
Yes. Feedback. All right. Signing off.